Hello, I'm Dr. William Streck, President of the Bassett Healthcare Network, and I'm here to provide an update to our community and the region about Bassett's activities in terms of the COVID-19 virus that has so affected all our lives. It's hard to believe that it was March 2nd that Governor Cuomo announced the first positive COVID test in New York State. Much has happened since that time. March 5th marks the time when the Bassett Healthcare Network took upon itself to launch the widespread screening and diagnostic program that has been in place since that time. We have overlapped with Governor Cuomo's executive order of economic and social shutdown, which came on March the 22nd. So what have we learned over this period of time, and where are we now? Well, first, we're on the downslope of the curve. That's pretty clear in the state data and in Bassett's data that we have hit the peak, it appears, of the COVID presence, and we are now on a curve away from that peak. How fast that diminution occurs is not clear. But what we've also learned at Bassett and through the network and through the remarkable cooperative work of the network is that we could take care of this problem through our hotline, our triage, our screening tents, our physician and provider evaluations, and the preparations we put in place in the hospitals, so that we have effectively handled this problem for a wide range of the people in the region, people who were part of the Bassett Healthcare Network and others, other health systems which have not been as extensive in their program development as this. It's been a success. We've had 9,000 phone calls, 6,000 triages, 3,000 evaluations, and almost 3,000 tests, all of this outside of the immediate hospital environment. So we've learned and we've improved as we've done this. But there's another important element to this that we really need to recognize, and that is the fact that the Bassett Healthcare Network has continued to operate to serve patients over a wide range of activities during this same period of time. And we've done so in the same high quality, safe, effective manner that has historically been characteristic of Bassett. So that even though we've been putting all this emphasis on COVID, we've also in the month of March had 1,000 inpatients across the network, most of those not COVID related. We've had 50,000 outpatient visits. We've had over 500 surgeries. All of these quite successfully and safely accomplished, even as we've dealt with this other issue. Now, it is true that there are elements of what we can do that have been limited. They've been limited by the governor's executive order, for instance, that no elective surgery should take place. So what we have now is we have a backlog of a lot of these services. We have other services that have been used less, and we are now reopening and will reopen progressively over the next month and beyond to bring all these services back to the community. The sum of this is this. We learned to handle COVID. We learned with our testing and our screening, and in the future, we will be even more adept at this because we will have much more sophisticated testing, quicker results, and the knowledge of how best to segregate this problem, handle it effectively, protecting our patients and our employees, and doing the job well. At the same time, we are now moving to re-expand all these other services that are so important to our community. And these are important. We need the cancer screening tests. We need immunizations for all our children. All of this will come together. You will see some improvements within the Bassett system when you come in as a patient, less waiting time, some variations. We've learned, we're better, we're prepared, and we're moving forward. Thank you.